Another key to a successful clear aligner case is good quality pictures. Let's dive deeper on the why. Taking clinical pictures is important for several reasons in orthodontics. Although we will focus this video on the reason why they're important for treatment planning and tracking purposes, just note there are other reasons why they're important. For example, for tracking the treatment progression of soft tissues, also for marketing and patient discussions, since we all know that a picture is worth 1,000 words, and showing a patient a progress picture can actually help with treatment compliance. Also for legal purposes, and we all know that this extends past orthodontics into other areas of dentistry, and for research, publications, and lecturing. Now, as I mentioned, we will focus on orthodontic pictures' importance for clear aligner treatment planning. Taking initial pictures will aid you in defining your diagnosis and goals. It will support your dental technician with your treatment plan and will serve as confirmation of the patient's presentation when compared with other diagnostic records, such as your dental scans. Let's look at this case. As you know, optimal facial aesthetics is a key objective of orthodontic treatment, and this case exemplifies it beautifully. For this patient, we notice on her initial presentation slight deviation to the left of the interpupillary line, and we also see that the intercommissural line is not parallel to the anterior occlusal plane. After treatment, all this has been corrected. Just think that without an initial picture, the dental technician could not have achieved this great result. Just discussing the smiling picture for this patient too. We see on her initial picture a reverse smile line and a deviated midline. Thanks to this, the technician was able to plan for a convex smile result and an aligned midline, much more aesthetic. When you acquire a smile picture, you can observe several things, such as the amount of incisor display, any cants, such as with this patient, amount of gingival display, so the gummy smile that this patient also presents, midline deviations, buccal corridors, tooth proportions to align with the golden rule, etc. Also, we know that side profile pictures are important for planning for facial aesthetics. It is crucial to not assume that just because a patient presents with, let's say, class 2 occlusion, they will have a convex profile. Sometimes this is not true, and they actually present with a straight profile. So knowing this information is important to make sure we're planning movements that will improve facial aesthetics and not do the opposite. One of the most important reasons for acquiring intraoral pictures is to be able to compare the occlusion to the one present on the scans. A lack of correlation can effectively change the entire treatment plan. In this example, we see that on the pictures, the patient presents with posterior open bite, which may lead us to plan for movements to close it, such as extrusion. As you can see, the scan's occlusion does not match. In this case, the real occlusion was the one present on the scans, meaning that if we will have treatment planned this case based on what we saw on the pictures, the movements would not have correlated with the patient's actual situation. Please note, sometimes the actual occlusion is the one present on the pictures, so it is important to check that they match in both the pictures and scans, and retake any records accordingly before submitting your case. If you submit good pictures, our expert technicians can take into account the patient's complete records to give you an aesthetic and functional result. Here you can see the picture that you should submit with your case. 3 extraoral images, so profile, full face, and full face smiling, and 5 intraoral images, upper occlusal, lower occlusal, right view, front view, and left view. Here's everything you will need to capture good pictures. As taking good pictures is an art worth learning for your dental practice in general, I suggest you take the time to learn more on its specifics. To do so, please go to our manual section on your doctor's portal and open the file named Submit orthodontic photos.